if you can't see, please.
How about if you start with the functional screen and let's see if we can see what's happening. So you can phone a friend whenever you want. You can reach out to the crowd and we're here to help you. And then maybe we'll call a timeout if we have some questions though.
Okay. All right, Sada. We're just gonna work on some motions right now. Just follow my lead and just do the same motions as me. Okay?
Okay.
All right. So first you're gonna shrug your shoulders. All right. Bring your arms all the way up to your head to the sky. Good. Can you bring your arms all the way back? Good. And can you act like you're doing a jumping jack? Bring your arms all the way up.
Wait, time out. You corrected it, but what would you have her do to go into shoulder abduction?
Thumbs up.
Why?
So it doesn't get blocked by the
Okay.
Because there's a process in your shoulder that's not.
So everybody, just kind of hold that thought for a minute. Everybody go into a lot of shoulder internal rotation and try to fully abduct. Don't look at Kristen though. She's pretty mobile over there. What in the world?
Double jointed. Yeah, something incorrectly. Yeah.
Now go into a little external rotation. Now you can do it.
Oh, okay.
You have a beautiful little tuberosity there that gets in the way.
Yeah,
And then I correct.
Yep. So when you go into abduction, be sure that they're externally rotated, and the easiest way to do that is say just turn your palms up or thumbs up, and they'll naturally externally rotate, and then you cannot cause an impingement.
Okay, thank you. Do you want me to continue from there?
Yeah.
All right. So we're just gonna bring your palms out like this.
Okay.
Reach them all the way up from your side to the sky. Good. Going back. Okay. Now we're going to bring your arms up like this. Okay. Can you flip your palms up? All right. Now touch your hands to your shoulders like this. Okay. All right. Can you bring them down? Okay, now could you put your elbow to your side like this? Okay. Can you flip your palms up? Flip your palms down. Make stop sign. Bring your hand. Sorry, wave. Make a tabletop. Claw. Touch each finger with your thumb, and we're gonna wash your hair. All right, and tuck in your shirt. Good. All right, so I am gonna take a few measurements of your left elbow. If that's okay. Is that all right with
She
you?
almost looks like she's got a shoulder patient. Did you not see this gentleman in your sim?
What?
Did you not see this gentleman in your sim where he
had
was
the
trying to
lady,
portray?
the
Oh,
lady.
okay.
I did it too. He was
The
really.
gentleman. So he was trying to portray an elbow problem, but then it looked like shoulder and wrist and a little bit of everything else.
Yeah.
Yeah.
He did say why. Apparently he had a shoulder injury.
Oh,
at one
okay.
point. So he's like, I had a shoulder injury.
Okay.
I had one.
But you're right. She was trying to portray the elbow here. So let's figure out what her muscle grade is for that elbow.
Okay. All right, so now I'm just going to take a look at the strength of your movements of your elbow. All right, so could you bring your arm up like this? Okay, and then don't
Now wait a
let-
minute.
oh,
Did she have
sorry.
full active range of motion
Um,
against gravity?
Full active range of motion.
Let's see. Let's ask her again. Can she do it? Do you
Um,
have full active range of motion against gravity?
No.
Are you sure?
I understand your jargon and the
So
answer is
we
no.
we wouldn't do that.
Because she
We
can't even
wouldn't
go
do-
against gravity,
So
so
you
why
need
would
to
she be able
put
to
her in
take your
passive.
But you need
resistance?
to put her.
Yeah.
So side.
Okay, so I'm going to bring you to. I'm gonna phone a friend.
Good answer. Good answer. I see a friend right here.
All right.
Could you have her put her arm like that and then see if she can do that?
What do y'all
Or do you
think?
have to lay them
Yeah.
on their side?
So you're gonna have to off.
If she could rest it on like a table.
Well, if her shoulder's not affected, that
Yeah, if your shoulders
Is that me putting your elbow in a gravity eliminated plane?
Yeah.
it's going parallel to
Gravity.
Okay, here's
Because you would push it
It's
down,
so
so
gravity.
it would.
gravity, gravity, gravity.
Yeah.
Is it hurting your, is it hurting your ability to do flexion or extension of the elbow?
You can even, God, you can even rest it right here.
Oh,
Yes.
would it be
If
this
you're
way?
worried about her
Yeah, so
shoulder
you can
strength,
rest
look
it.
at that.
You can rest it here
support
and
the
have
upper
her
part
down.
of her arm.
Yeah.
Right.
So you can be her table, okay? And then, let's see if you have full, you can be her table. Now, do you have full active range of motion in a gravity eliminated plane?
Okay, I'm just going to bring your arm.
No,
No, let her
you wanna
bring
see
her
what
arm.
her muscles can do. So this is kinda tricky, so you need to, give her support without helping her move.
Alright, can you just bring your arm flex?
Maybe she could touch your chin.
Okay.
In towards your chest.
Could you bring your hand in towards your chest?
Just walk with her. Ouch.
Oh, okay, that's alright, you can stop right there.
Okay.
Okay, now, I'm just gonna push it as much as it can go.
Now why?
Because she can't do her full, so we're measuring the passive.
Okay,
Okay, so, I'm just gonna push it, let me know if it hurts.
It hurts.
Oh, okay, alright. Alright, so now we're gonna do the eliminated, but I need to phone a friend because I'm not sure.
what did you just test? What muscles did you just test?
The elbow flexion.
Okay, what else happens at the elbow?
There's pronation and supination.
Yeah.
Okay, so,
And,
extension and,
okay, do you wanna test elbow extension while you're here?
yeah, I could do that,
Okay.
yep. Okay, so, can you just put your arm straight like this?
Yeah, that's telling you the range.
Okay, so, okay,
So just stay where you were before.
alright,
Stay in the gravity eliminated.
right?
Good job.
And then we're gonna do,
Be her table.
okay, so we're
Just let her
measuring,
open it up.
wait, what are we measuring?
Elbow extension,
Extension.
gravity
Elbow extension,
eliminated.
okay.
Extension.
Alright, so can you bring your arm outwards like this,
Push into me.
towards me, yep,
Okay.
as much as you can.
Okay. That's good.
Oh, right here, okay. Now I'm just gonna see if you can do it a little bit more, but let me know if it hurts, okay?
That's good.
Oh, okay, alright. So,
So she still can't get active range of motion gravity eliminated with elbow flexion or extension, so she's not even a 2, right? Wait, no, she's a 2.
She's not even she's not a 3.
She's like a
She was
one.
she's definitely a 2, but wouldn't it be like
The
a 2
definition
minus?
of a 2, let me put the definitions up here. The definition of a 2 is full active range of motion in a gravity eliminated plane. So
she's
she
not
didn't
even
meet
a
that
2.
definition.
But she was able to move, so it's
But
not
one
a
is only
zero.
tradesman movement, so it'd be between the 2 then, right?
That's where the pluses and minuses are, and we're not dealing with that right yet.
So with this, she'd just be a 1.
She didn't meet the criteria for a 2, so she's gotta be the less than.
yeah, that was nothing like.
If you do gravity eliminated, do you have one in your sim rooms?
Yeah.
Yeah, there's a bed in there, so if you do need to utilize that during your final, you will be able to.
We'll be so ready for that by then.
That's how you felt
I like your
today.
confidence for us, Julia.
Does the head go down and
Julie's like,
lose?
There'll be no blacking out.
No blacking
No, we're blacking out.
Thank you.
Sorry that we forced it.
I'm ready to I like to learn, like, but then like,
Oh, yes.
usually fine.
Yeah.
Oh, I still have to do that,
Oh,
yeah.
okay.
Okay, sorry. Okay, so right now, can you just put your, try to put your arm like this, as you can. Okay. And then can you put your hand like that? Good. Okay, so I'm just going to, okay, I'm just gonna, okay.
First, see
So-
if she can do it active.
All right, so could you just bring your palm down? Like, bring your palm down, like.
Oh,
that.
sorry.
Yeah,
Okay.
sorry.
It's okay.
Okay, so, all right, so that's good. All right, can you bring your palm back like that? All right, and then could you bring your palm out. Okay. Looks pretty normal. All right. So I'm just gonna. Oh, wait. Okay. All right. That's good. All right. I feel like that was good.
Go ahead.
Oh, okay, so, yeah, wouldn't you could either do it like this, because then gravity's going down on it, so it's not affected.
It's a
'cause
transverse.
It's in the transverse plane,
Yeah.
you could do that, or I guess you could do that.
Arm down to the side.
this one
Yeah,
because if
Would
you
you
put gravity on what you were doing.
I think when you do it down here, though, you can rotate the shoulder.
And what we're learning right now, what you're teaching us is putting it,
So, yeah, like
again,
this.
with no gravity at all.
Okay.
So putting this is against gravity, so we're gonna bring it up this
Up
way and the
that way.
transverse.
Up. So up
So
like.
have her go up. Yeah.
Okay. Okay. So can you just
So support her elbow.
Gotta hold her, there you go.
so can you bring your palm inwards as much as you can? Okay. And then I'm just gonna wait. Do I push it in like more?
No, she can't do it against
Alright.
gravity, so she wouldn't be able to do it against
All right, and then just put it normal like this, like how you had it. Like, all right.
Yep.
All right.
Yep, that's
Beautiful.
Yeah.
And then,
It's good.
So that would be a 2, right?
yep.
Yep.
Yep. I think 2.
Cause does she have full range against,
It's not.
with gravity eliminated?
Yeah.
I'd say that's full. It's flat.
Yep. 2, I believe. Yep. You're good.
Keep it
All
further.
right.
Thanks, guys.
Right.
She's going for
Does that make sense?
Covered them all.
Does that make sense?
I'm not gonna believe this, but the sim patient messed up. What was your number?
Me?
What was your grade, your muscle grade? Look in your pocket.
I was a 3.
Oh,
so you were supposed to
So you were
What did
supposed
you
to-
want to portray?
Full range of motion.
Full active range of motion
Against gravity.
against gravity.
But that was all good for them to see.
Yeah.
That was a very beneficial,
But sometimes sim patients mess up too, don't they?
Yeah.
Actually, yeah.
I don't even know anymore.
ask questions now if something doesn't make sense.
Good job.
So I do have a question then,
Yes, ma'am.
because I know when we just did our range of motion, I didn't place them in against gravity every single time, I don't think, because when I did like ulnar deviation and radial deviation, I had them do this.
Yes.
I know I could have done it this way,
Yes.
but like doing radial deviation, am I gonna really have them go?
If you technically want
For
to see
ulnar?
what they can.
This would be against gravity, wouldn't
For
it?
radial.
For a radial, but not for ulnar.
Oh, right.
Ulnar would have to be like, so,
Mhm.
how the book shows it though.
How she showed it just the second time?
Yeah.
Mhm.
so that's what we're expected to do when we do against gravity, is place them in a position.
This
That's
This would
gravity
work.
eliminating for
this is what I had them do.
radial.
'Cause that's against gravity both ways.
Radial is against gravity now,
You're
and
pulling
ulnar
up.
is against
Oh,
gravity
okay.
now.
So like they said, this is against gravity, if I have to do it like this, like we do when we have hands.
Okay, so I'm gravity. Ugh.
That's without gravity.
That's why I'm confused, because I thought this was without gravity, but
That
what
is
is
without
this?
gravity. You tell me, what's happening here?
Halfway?
Okay, well, let's just kind of see to start with. I'm gravity, and if you, let's just look at radial. Let's just look at
Gravity
radial
assisted.
deviation.
Push down against gravity.
Like this?
What impact is, so go back to your other way. What impact is gravity having on your radial deviation?
It's not.
It's not.
Okay.
What about your ulnar deviation?
It's not.
Okay, and then are you really, so you're doing a really nice job there, but how many patients actually did supination pronation instead of radial and ulnar? Did you see any of that?
in their hands, yeah.
Where they did this.
So the motion may look the same, but are you really testing what you thought you were testing? I'm not sure that everybody was.
So during the functional screen, we should do like
This is
up like
right.
this and then what,
That
like
is
this?
technically against gravity.
So maybe when they're washing their hair, can we be like, move your
You
wrist up?
can, yeah.
Okay.
Yeah. The other thing that happened a lot was with, not a lot, but I saw it some, supination and pronation. Am I testing supination and pronation?
You're doing shoulder internal
And
external.
internal external rotation.
So you have to be sure to lock in their elbows so you're isolating the supinators and pronators.
Yeah.
That made your mouth go open, Veronica. You're like,
I'm for out that.
Oh,
I was
what?
like, that's-
Tori, yeah, Victoria.
Me.
Can you do it this way though? So while
Say
you're
that again.
doing Elbow flexion
You
extension.
could, if you're fancy enough to like combine it, you can combine
You can
it.
still
Fancy.
internal rotate when you're doing it.
Mm-hmm.
But if you don't,
At your shoulder.
if you keep it straight out.
This is, you're able to isolate it here.
It's really hard not to rotate your shoulders if you're out here.
Mm-hmm.
Depends on what they're wearing, whether you can even see that.
Mm-hmm.
If they're wearing a hospital gown, you probably can't see their shoulders move at all.
So, let's do another muscle grade, and then we're gonna come back to your question about like, are we really doing this, are we not? Who's next?
We have a question. For like for the elbow, for example, when I was modeling it, how would I, as a patient, demonstrate a deficit if I'm not supposed to like?
So you have
For her to
full
know.
active range of motion against gravity,
Right.
and it's not until they add the resistance that they know if you're the difference between a 3, a
So
4,
she
or
would have
5.
needed to test all 3 parts when I was acting that out.
Your shoulder should have been fine,
Right.
so you would have had full active range of motion against gravity. And then when she came over to do the manual muscle testing, she's probably starting at the shoulder. She's gonna come down to the elbow, and with that,
That's
you're
where I was
just,
supposed
you're,
to
you
start my
can't take any
limitation.
resistance.
Okay.
And the same thing with, that's so good. With your tricep, you can't take any resistance. And the same thing with your forearm, you can't take any resistance. So you have the movement against gravity, but you can't accept any resistance, you break.
Okay.
So when she was doing her frontal screen, she was still.
I should
You
have
would
just
have
done
been able to do it. You were just
everything.
like,
Wouldn't have known
I
that.
thought I was supposed to be
showing her like, hey, this is
Okay. I have a question then, because we did wrist extension and flexion. Obviously flexion is not against gravity if I'm going down like this. But I feel like when I do this, I get like a lot of range of motion. When I come up, I can't like, I
So
just
good
don't
question,
naturally.
good question. We're talking about 2 different things. We're talking range, and if I were to say the word musculoskeletal system and I separate those out, and we have a skeletal system and we have a muscular system, what are we looking at when we're looking at range of motion? The skeletal system. What are we looking at when we're looking at muscle, the manual muscle testing? The muscular system. So they're 2 separate things. So range of motion you're seeing is the joint
So it's okay
intact.
if you do it.
So gravity here, there, wherever doesn't matter so much with looking at joint range of motion, that active and that passive. Are you able to combine things and be fancy and gather more information in a shorter period of time? So you can kind of combine the range and the muscle testing so that you're getting the max amount of information. But in your mind, you still are probably thinking about them as 2 separate things. Yeah.
That makes sense. I'll go.
All right. Are you the patient or
Sure.
the?
You want to?
Okay.
I'll be the
Oh, wait. I don't. I'll rock, paper, scissors you for it.
Who's the patient?
I'll be the patient. Is it okay?
You'll rock it.
So grab a joint.
Question everything. Oh, I was like waiting for the card.
Not
You
this
already
time.
did the therapist.
And now you're gonna piss a muscle grade.
That's okay?
Yeah. Do you know how to portray that?
I think I can.
Alright.
Okay. I think so. I think you can do it.
So should I be changing how I do it?
How well?
You
And I don't-
can,
just
you
like
can.
I
We'll
agree.
investigate that a little bit further.
I'm
Are you
gonna
able
switch
to
this up
help
a
me
little
take
bit.
Okay.
So, functional screen, just to copy your range of motion. Move it in your arms. Okay, so I just want you to copy what I'm doing, okay? Can you shrug your shoulders for me? Good. Okay, can you raise your hands all the way up over your head, thumbs pointing up? And then all the way back down, and then bring your arms back behind you. And then back. So with thumbs pointing up, I want you to bring your arms out like a jumping jack.
Sorry.
So
Hey, focus over here. No cheating.
Yeah.
Don't look.
Huh? Oh. Oh. Okay.
Continue.
Sorry. With your thumbs pointing up, I want you to try to see if you can bring your arms all. And then all the way back down. Okay, now bring your arms straight up in front of you, palms up. Touch your thumb, or touch your shoulders. Back down. Can you do your elbows in? Oh, actually, before we do that, can you bring your hands behind your head if you're washing your hair? See if you can move your wrists up and down like this. Okay. And now we're gonna go, pretend like you're tucking the back of your shirt in. Good. Okay, so elbows in, palms up. Okay, palms down, wrists up, wrists down. You look good. Okay, make a fist. Open your fingers. Do bear claws. Do a flat palm. And touch your thumb to each finger. Okay, so it looks like all muscles are within functional limits for active range of motion.
Good. Wait, is that true?
It is.
All joints.
All muscles.
All joints.
For active and passive.
No, just for active. And passive.
Yeah.
And passive.
Yeah.
Yeah, because she's a functional, yeah,
The joints, yeah.
functional. So for range of motion, you are within functional limits for all joints. Good job.
But you don't know anything about her muscle strength.
No, so now I have to check
You know a little bit about her muscle
You know she's
strength.
at
So I
least a
put
three.
the-
It's
I
three
put
or
the
up.
grades up here. and I
Yeah,
want
she's
to
at
for-
least a 3 in
She's
all
at least a 3.
areas.
You don't know if she's a 4. She could be a 3, 4, or 5. You have to investigate further.
Okay, so now I'm gonna check your muscle strength, so I'm gonna push on you, but just try to resist me, okay? So I'll put you in the motion first, and then I'll tell you when to resist me. Okay, so hold your arm there. Don't let me push you.
So stop. So she's stabilizing at the joint, and she's moved the other hand as far away as she can without crossing the next joint.
Okay, now don't let me push. Good. All right, so now I'm gonna bring your arm out to the side.
Duck.
Don't let me push. I know you told me not to do this, and I accidentally did this in the sim where you do that, so we don't have to. Okay, so can you bring your arm down to your side? Elbow at 90. Okay. Don't let me pull you.
Yeah, we had a timeout.
Yeah.
Extension,
Yeah,
you have to put extension in extension.
Shoulder extension.
Did you do it?
That's what Professor.
I had it up here when I did it, so does it matter where they're at?
Did you test extension or just
I did.
abduction?
Yeah, she did this and then
She did it while she was
Oh,
still
you
up
want-
there.
Can I do that or
I
not?
thought you were
Supposed to be
testing the
extended.
adductors. So yes, technically, whatever motion you want, you've got the full range. They need to be in the halfway point.
Okay.
Your muscles are not as, but that's what you're doing with the shoulder flexors, right?
What I did was I pushed,
Shoulder flexors.
and then I did this.
Okay.
You will definitely
That's
see
not
that out in the world. You will definitely see that, like in acute care, for
So,
sure.
so
just
technically,
be-
to do
just a heads
shoulder
up.
extension, you're bringing them to the halfway point. So your muscles have a little bit more, they're at their best use of power in the mid-range. And so you're gonna place them in the mid-range.
Okay.
Time in.
Okay, so I just checked her extension.
So you're at internal.
So now I'm gonna do internal, external. So here's internal. Don't let me resist. Don't let me resist.
Okay, time out. What, so I see your left hand where it's placed. No problem with it. But what muscle group is she testing? She's taking her into internal rotation, but what muscles have to activate?
External.
Hmm?
Like specific muscles?
You're testing right
You can say group.
Oh, deltoids.
External rotators.
Yeah. So these muscles have to fight. So you're pushing here, Megan's pushing here. This set of external rotators have to kick in to resist that motion. And just the opposite, put your hand for your internal rotators. Now the internal rotators have to kick in to resist moving into external rotation.
Only one joint. I'm below her wrist. I'm right.
Yeah, we can't really. Yeah, I mean, I can
So
see it,
for
but-
elbow flexion, if I'm resisting, then the extensors have to come down. So it's always the opposite.
No.
What
Just
are you trying to
internal and
not let them
external.
go
rotation.
into?
When you're going into flexion, what's kicking in right here?
Mm-hmm.
Oh, but it's the opposite for internal, external.
Just think about what's working. So I'm gonna resist you here. What is having it kick in? Your internal rotators,
Well, I
right?
don't think.
And then I'm gonna resist you here. What's
Yeah, but
kicking in?
this was not, I think that was really.
So it's opposite, yeah, when you're testing it, right?
Internal and external rotators feel weird. The rest of it, like especially biceps, triceps, is more straightforward.
Okay.
All right. Okay.
I wasn't sure what we.
So I'm gonna bring you at the halfway point here. So I'm gonna, don't let me resist you. I'm checking flexors. Don't let me resist.
Now, did you really test those triceps in against gravity plane?
Can you bring your arm up like this? All right, raise your arm all the way up to the sky.
So this is a little like the radial and ulnar deviation, like, no, you didn't. But let me ask you this. If she is a 3, a 2, a 1, or a 0, are you gonna be able to come up and give resistance and get a good amount of resistance from the patient if they're, yep. So even though technically you didn't look at her triceps in a gravity eliminated or against gravity plane, if she's terribly weak, you're not going to add resistance, and they're not going to look like a 5, and then you add resistance and there's something different. So the fact that you're technically not going against gravity for some of the functional screen things, when you're coming in and add the resistance, you're still going to pick up on the correct muscle grade. Is that okay?
Yeah.
You say that last
But
one
if you
one
do
more time.
notice that, like say I don't test her against gravity and I do notice a weakness, I'm gonna then try to go, like, backtrack.
Mm-hmm. I think if I repeat it again when we go into gravity eliminated, it would make more sense.
Okay.
Okay.
This, you did
Yeah.
this, and then you did this.
Okay.
You got this done.
So now we're going
Supination,
to-
pronation.
Okay, so don't let me turn your wrist. Good. So don't let me push your wrist.
Now you can't easily put that one in against gravity plane.
Yes,
And what would that look
but I
like?
think if we already assess, that would.
Why
Oh,
do you
against
need to in
gravity
that
plane?
case?
So like I would,
You wouldn't need to in this case because
I
she
know,
showed
cause it's the manual muscle, cause she
No, I
already
thought I
showed
was
me
just
the.
asking.
So like against gravity would be extension, flexion. Right, is that what you're asking?
Mm-hmm.
So if
Can
you
you
were
show
to,
us what it would look like to do the manual muscle testing in a gravity resistive plane?
Yeah,
So let's
so
do the
manual
wrist
muscle and gravity
extensors
resisted for extension.
and put her halfway. So
Oh.
bring her into a little bit of extension, let those extensors kick in. Okay.
And then flexion, so I'm gonna turn you up. I'm gonna bring it halfway up. All right, now resist me.
Mm-hmm. And then radial and ulnar, what would it
Okay,
technically
so
look like
here.
to stay in a gravity against gravity plane?
So hold it there. Don't let me push you.
Nice job not crossing the next joint. You see she's way up there at the MCP. She's not crossing distal to the MCP. That's technically right. Mhm.
good.
Okay, so I'm gonna go halfway a little bit. No, don't let me push. It's really awkward.
Very
Mhm.
awkward.
What are we
If they
Oh,
were
their
sitting down, it might be a
deviation
little
against
easier
gravity,
for
but
So what was your muscle grade throughout, Brian?
She was
What
a
were you
5.
trying to- Uh-huh.
yep, all resistance was a 5.
That's why I was like,
You were
time out. Because
But
I'm
that's-
like, we're
So she
supposed
was
to
normal then.
have
there was
anything?
Oh, I'm like, am I missing something?
No,
Nope, that was it.
I thought I was
She
missing
didn't have
something.
You missed the Good job, Megan.
Yeah,
Good job, guys.
That is ideal.
it makes sense because I remember learning that that's where your most strength is halfway.
Okay.
I
Who's
have
the
a
patient?
question.
Who's the therapist?
Me.
Okay, just volunteer.
I have a question about like internal, external
I
rotations.
have
They
a
said we
question
could
about how
measure it
do you
here.
document if it's in gravity eliminated plane?
No, because you know that by the numbers.
Oh, yeah.
They know that it had to be gravity eliminated.
Then it would be less than a 3 to
Yeah. So if it's a 1 or 0, it has to be gravity eliminated because they can't do it against gravity.
Yep. True.
We saved the best for you, Julia. Sorry. Oh!
Can we lay down on this?
Right, yeah.
So how should we stay in a wheelchair?
Yeah.
So are we getting marked down for all of that? Are we didn't break down for us. Okay. So the functional assessment. Okay.
No.
So I'm gonna have you shrug your shoulder. You want to promote
It wasn't clear.
and then all the way up. Okay, good, and then back down, and then back. Good, and then if you can put your arms on your side and put your thumbs up, and then up like the jumping jacks. Good, and then back down, and then wash your hair. Good, and then pretend to tuck in your shoulder, or your shirt. Very nice. And then elbows at 90. Good. And then turn your palms up, and then palms down, and then hands up like stop sign, hands down. Good, and then wave at me, and then make a fist, and then hands spread out. Good, and then bear claw, and then a tabletop, and then touch your fingers. And then one last one if you put your hands out, and then touch your shoulders. Okay, so
Good job.
clear that she
What's her issue, yeah?
right shoulder.
Okay, what do you wanna do next?
So she wasn't in, as far as range of motion goes, she wasn't full. So then I would full active. So then I would put her through passive.
Yeah, let's see what her passive is.
Okay.
Because if her active and her passive are the same, does that mean it's a joint problem or a muscle problem?
If her passive and her active are the same, then it's a joint.
Okay, and so if her active is a certain amount, but if you're able to get more passive,
Then it's not a joint, it's a muscle.
the muscle's not strong enough
Because
to
I'm acting
deliver
as
it.
her muscle.
Mm-hmm. So let's check out her passive range.
Okay. So if you can lift up your arm as high as you can, good, and then I'm gonna assist you as far
Okay,
as you
hold
can.
on
and
one
if
second,
it's
where's
pain-
that right hand?
Approximately the other.
You don't
But I
want it
thought I
pressing.
was just moving her up.
But you're gonna have to support her, cause she may have, you don't know if this is muscle weakness or not yet. So
Okay.
you don't wanna, you need to go as distal as you can without crossing the next
Okay,
joint, so
even
you'll
with
come.
range of motion stuff.
Mhm,
Okay.
yeah.
Okay. So I'm gonna move you as far as you can. Any pain?
Mm-mm. So now on your sheet, you have said her, passive range of motion is within functional limits, but her active is whatever the Goni says, which is
Right.
around 90-ish
Right.
for the active shoulder
Okay.
flexion.
Shoulder flexion. Okay, and then extend your arm back as far as you can. Good, and then I'm just gonna push you. So then that looked normal.
So good passive again,
Passive
within
again.
functional limits.
Okay, and then I'm gonna have you lift your arm up.
What are you gonna do with that thumb?
Oh, thumb to the ceiling, please. Good, and then as high as you can. Good, and then I'm gonna. So again, it's within normal limits.
Did you really? What's your passive range?
Oh, okay. Keep going.
Does it go all the way
That
up?
hurts, that hurts.
Okay.
Okay. So then I would have her relax, and then I would do gravity eliminating with
Okay,
this.
there's a couple of things you could do here. So the shoulder does flexion, extension, abduction, adduction, what else?
Internal and external.
What does it look like to do internal and external in a gravity eliminated plane?
It is gravity eliminated.
Oh, so I see you. And I'm gonna come play gravity. What is the effect of gravity on your external rotators? So gravity is resisting you here. That's not gravity eliminated for your external rotators. What is gravity doing for your internal rotators? It's gravity assist. Yep.
So you would go like this, and then like this.
Say that again?
So you would do.
I think you would.
No, you're looking to eliminate gravity, right?
Not assist or.
Yeah.
You don't want gravity to help either.
You don't want to.
Julia, you were right the first time.
What is gravity eliminated internal, external? Yeah.
Yeah.
But she didn't have it right, so I was coming over
Oh,
to.
I thought you were saying wrong.
No,
Wrong.
no, no. You got it right, because you know this, right?
Yes, I do.
Yes, you do. So, Melissa's up here, you're putting her gravity eliminated plane on gravity. And let's just see how well you do with your internal, just kind of move it around internal and external. Gravity is not having an effect on that motion. So gravity eliminated. in your internal and external. So her passive range is good. It's within functional limits. She had some active range of motion issues though, and you've already taken the gonio and measured that.
So
Megan?
I have a question because like she did active and then passive against gravity to get a range of motion. So what would you do for like if you wanted to get against gravity with external, but she can't even get up high enough to be able to like rotate? I mean, is this considered against gravity, or how would you do internal? Laying on your side.
Against gravity?
To get like that,
But why are you doing against gravity if she
because she was
can't
trying to get the passive, right?
But the passive is the passive. It doesn't necessarily matter. Because your passive is looking at the integrity of the joint.
Yeah, you're doing the
Yeah.
Against gravity has an effect on the muscles. So there's the skeletal system and there's the muscular
So it
system.
doesn't, that part doesn't.
Can you
So
repeat
what-
the question?
Yeah.
Sorry, I didn't hear. What was the question with the?
I was just saying because she did like active and then like passive against gravity, active and passive, but then she did this one gravity eliminated. But if you're testing passive, it doesn't necessarily have to be against gravity because you're checking to see if it's a joint thing.
So for Melissa, our patient's
If I said that right.
comfort, Julia was able to do the functional screen, and then she's gonna look at the things in gravity eliminated, but she was able to grab internal and external right here in gravity eliminated before they moved to the mat. Because otherwise, she would have moved to the mat, done some mind and muscle testing, and then had her stand back up to get back to this internal and external stuff. But this is a lot more comfortable just to move to the mat one time, right?
Yeah.
So I'm gonna have you lie on your back with your head right here.
Keep messing up Josh's
Good.
shots.
And then, so for shoulder abduction, this is gravity eliminating for shoulder abduction.
It is.
Right.
But her arm is so weak, she can't even lift it up against gravity. The forces of gravity overtake her.
So I'm
So
gonna
you
do
want to be her table. You have to keep her in a pure line of movement. So you're not helping her with the movement. You're going to see what her muscles can do, but
Okay.
you're giving that arm support so it stays in the right plane.
So I'm gonna support your arm. I just want you to move your thumb towards your head as much as you can. Good. And
So
then
what
relax.
did Melissa just demonstrate? Huh?
Because she was
I heard
able,
it too.
because gravity was eliminated, so that makes her a 3 and under. But then she was she had full, but I had to assist her, but she was able to get it there, so she's not a 1 or a 2.
Full active range of motion in a gravity eliminated plane. So that is what's written up there. You can't see it very well from here. That is on your blackboard side as well. So that was abduction in a gravity eliminated plane.
Yep.
What else? And you'd already looked at internal and external.
So now I have to do flexion and extension.
Mhm.
So I'm gonna have you side lie on your left side. And then, then I'm gonna assist her from going, this way, yeah. So shoulder or thumb up and.
Nice table?
Huh?
You're
Okay.
being a nice table?
Move you through here. Good. And then I'm gonna move your back.
You're moving her?
No, I'm gonna have you move back. I'm not assisting her, sorry. Move back as far as you can.
So what did Melissa just demonstrate?
Good.
Because she was, what was the definition of a two?
Full range of
And she did that just there with internal and external, flexion, extension, and abduction.
Yeah.
Okay. Do you have any pointers for Julia?
So then, well, I know. So then we write W above for passive range of motion, and then write for active we would put for a 2 or like 2. How would we write that?
Well, those are two different things. You're saying active range of motion, you're looking at the skeletal system.
Okay.
So what was her active range?
So her active range Oh, okay, where was she at? I'm like trying to think. She was at like 90.
And you're taking the goney on that to get that, and then she showed even more passive, so that was within functional limits. So you have an idea of what's happening at the joint. Her inability to come up is not because the joint has an issue, the joint is intact, because she has full passive.
Okay, so that's one. Okay.
But there's something that's creating this lack of her ability to bring it up, which is probably the muscles are too weak. So Julia went on to assess that further and graded her a 2.
Okay.
So if I were to do the same thing, but help her, that would be a 1.
Helping her is not grading her muscles, though.
Okay.
You're grading your muscles. And how are your muscles? Pretty strong.
Wait, so yeah, what would
You
one
want to
look
see
like
what
for that?
they can do.
Okay, so how would for a 1, I would have been in the same position, but she would not have been able to do that.
But you would have
Well, no, what's the definition of a 1?
Evidence of slight muscle. She can do it slightly, but she can't go all the way.
You can see a twitch.
Lots going on.
Everybody kind of give their bicep a big and reach over there and feel that bicep. You might just feel the muscle contract.
Yeah, so I'm still here, I'm still asking to move. I feel the muscle contract, but there is no movement.
That
That's a
could
1.
happen, or there could be a little bit of movement.
Little bit, very
Um,
slight. And then if I ask her to do that and there's like 0, there's nothing.
If you
There's no
cannot even
contraction.
palpate a muscle or a tendon twitch, it's a 0.
So like with that, like would her arm just be like?
Probably just very
Like,
flaccid at the side, yeah. And you
So
will
like even getting it up like into this thing would be
That's
a 1.
why Julia's gotta be the table. Melissa, what does it look like when somebody's a 0 with their arm? Like they cannot even keep
Yeah.
it at their side, it
So,
just
like if she can
flops
get it up on
down.
her own, would that be like or like ish?
Something
Is
is
that like a
happening
1
that's
even?
doing that. So let go of Melissa. She might be able to pull in her scapular muscles a little bit and get this arm back a little bit.
Putting her into 1.
Maybe, but is it really the scapula or is it her true shoulder extensors or not? That's where you have to kind of palpate on that muscle group and see if it's kicking in. Because they'll make it, when they're that weak, they will do a lot of compensation because they want to move.
So they're gonna try to like-
There's no telling what they'll be doing. And you're going to try to isolate that to try to see what is truly activating.
So this isn't necessarily for her, but like, so when we do the functional assessment, we have them do like elevation. So there's not, is there like, how do you judge the range of motion on that? Like half, 3/4, full? Like what do you do in that? Like,
In all actuality, I'm going to have you sit up, Melissa, just so we can look. This will be through the summer, not this coming summer, but next summer. You can find the inferior angle of the scapula. And if can you depress one shoulder? So now when I find the inferior angle, I can see.
the difference between
Yeah,
the two.
and so this is something you'll measure a little bit more often with somebody that's maybe had a stroke or a traumatic brain injury. And so we'll do like an outline and palpate the scapula on both sides to be able to understand that asymmetry better. So right now,
this class.
nope, no. Do you want to add it this class?
I mean,
No.
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 Because we did it during our assessment, and I didn't know if that was
Yeah.
something that we should be paying
So
attention
it's not a bad thing because we are kind of saying arm, but the basis of the arm is definitely the scapula. So we're going to come back and get this when you're doing your neuro stuff. You'll have that with Dr. Truskowski, not this coming summer, but next summer. And so when you're talking about somebody that's had a stroke, somebody that's had a traumatic brain injury, the arm function is often dysfunctional because of the scapula issues. So you will definitely start there and work your way out. But let's hold that for another day. Okay. Do you want to practice another one, or do you want to look at bed mobility?
Can we have them all pair up and practice
Oh,
on a
that's
bed?
a great
On a
idea.
bed, like with Gravity Eliminated? I think
Yeah.
they all need to get each other on the bed and practice.
That will be on your point problem.
against that.
I'm sorry, Gravity Eliminated. Does she didn't show me full. Nope.
No.
So I have a joint problem?
Yes.
Baby.
So I could understand about her passive, her internal rotation a little bit more by bringing her up here. So now I feel comfortable the joint is not the issue. But let's say you don't feel comfortable with that. Ow, 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 ooh, ooh, ooh. And so now I am curious about her muscle strength. I'm able to see a little bit about her passive range. Can you bring it out? So I see you're active, and I see you're passive. And then, do you feel like her muscle grade could be 4, 5, 3, 2, 1? What do you think it's going to be?
3.
So you feel like it's at least a 3 because she showed you good active range within her limited ability right now. And so let me ask you this. I want you to fight me. I'm going to really test your muscle strength. And so bring your hand towards your belly. Okay. And am I giving max resistance? Okay. And so I'm going to say she's a 5 because her muscle was able to fire that much. But she didn't show me full active or full passive range of motion. But if she didn't have full passive, if she didn't have the ability to do full active range of motion in gravity eliminated plane, she would have been like a 2. Is this, do it again, consistent with somebody that's a 2?
No.
Okay.
So there's no reason to worry about gravity eliminated internally, you're saying?
There could be,
But not if they can resist.
But in this situation right here, is her problem anything to do with her internal rotators, her range of motion, her strength, anything? No. So you're having to kind of filter that through.
She said ow. You made her say ow?
I did. Because I didn't want her to be able to do that.
Everything is
Okay.
So even though technically that's gravity eliminated, and if you're gravity eliminated, you can't be anything above a 2, that's one of those scenarios where we just kind of.
That is also what we're testing with this. So if I'm here, I'm going to have you do the functional screen, and then push me away. Do I really have her triceps in a gravity against gravity plane?
No.
But she's giving me full resistance.
So it's okay to kind of bypass that, like.
There's a reason for that. If instead, so let me break you. Oh, now I really want to investigate a little bit further.
Okay.
But clinically, there's no way she can give me a lot of resistance and be a 5 and also have a less than full passive range of motion. Or, I'm sorry, less than full active range of motion. Those two are just not going to go together.
Okay. I get it now.
So you really want to know gravity, and you really want to know your muscle strengths and those grades, but there may be times like with the ulnar deviators that maybe I am testing right here. Push into my hand. Pull. Yeah. So
And that's fine.
she's not going to demonstrate a 5 or a 4 and then come up here. Now you can't do it. So if you, can you bring it up? Oh, she's fibbing is what she's doing. Right? Because that's not consistent. Like she can't take full pressure, full resistance, and then lack active range against gravity.
Yeah, because your strength is a bigger force than gravity is.
So there's these rules, and you want to follow those rules, but for the functional screen, trying to get everything in, unless there's a reason that you're really wanting to investigate more and put them in against gravity for everything, you may still be able to capture the information you need and what's going to matter for their function and not have to go against gravity on everything, because if she's still showing me a 5 or a 4, I know that I can feel comfortable with that muscle grade, that she gave that amount of resistance. That's how well that muscle is kicking in. Is that still seem fuzzy?
No, it's clear.
Okay.
To me.
And then, go ahead.
That's okay. Just I get some of the functional screening, how it's like hard to place them against gravity. But like I was talking with her earlier, elbow flexion extension, like we have them do this and like this. technically that's not full against gravity the whole time, right? Because isn't it like against gravity and then gravity assisted?
Yes,
Halfway.
you are true, right?
So
Is
why
that
wouldn't
true?
they do elbow flexion like this?
Could, that would be better.
Like
And
why
then you're
would-
testing.
We were told in the functional screen, like, so what?
You are still seeing what their
Oh, I do
joint
it
is
this
able
way.
to do, but you are
I do it
technically
this way.
right.
I
If you
don't
let
have
the
my-
arms come down,
I have
now the
strict
forces
right
of gravity are working against
whole
your
time.
biceps. What's it doing for your triceps?
Nothing.
It's assisting.
It's assisting them, I think.
But then if I come here and I say push against me,
Then you're,
and I can still feel comfortable that that's a 5 because that was a lot of resistance and you took that. If you were like a 3 or a 2, I might want to investigate that further and truly get you into an against gravity plane to investigate more and feel more confident with my scoring.
So is that just where like clinical reasoning and judgment comes into play, that like gray area?
Yeah. Before this, if you do the functional screen and then do the measure what you need to for the GONI, you're going to measure everything about their active and passive. That's either taking place through observations through the functional screen or using the goniometer and then taking those muscle measurements.
I have a question.
Mm-hmm.
So if it's a joint issue,
Mhm.
not a muscular
Very good
issue,
question.
then we're gonna see limitations whether it's gravity eliminated or,
What would that look like? What does that kind of client look like?
so they, if it was my right shoulder again,
Okay.
I wouldn't be able.
So that's your active range. Yep. Come on down, Melissa. Let's check this out.
Like
And
your
then-
brakes.
We're done with that.
So what's your available active range against gravity? Okay. And then now I'm going to passively see what she's got. Can you go any more passively?
No.
So then
Is this a joint problem or a muscle problem?
Joint
Joint problem. Huh?
You're being muscle, right? You're
I'm trying, yeah. I can't get any more passive range because that joint has no more available range. That was it for the available range. Ugh.
So then, at that point, there's no reason to even go gravity eliminated.
It's not, I don't know right now that you have a problem with your muscle. I know you have a problem with your joint,
Okay,
but I do need to test your muscle.
okay.
Okay, so I'm gonna go halfway to your available range, and I'm gonna add some resistance. Can this be a 5, 4, 3, 2, or 1? What are you gonna say? Our active and our passive are the same. I've got a bony block at that joint.
Sylvia,
They're the
her
same.
muscle could be a 5. Muscle would be a 5.
At least a 3. So Julia's saying it could be a 5, is that right? Who disagrees?
I don't think so. Because it's not going through full range of motion, so it can't be.
Well, after
It's going through the full available range though.
But not full active.
Do I have more passive than I do active?
No.
No, because my joint is blocked.
Mhm.
So why isn't, and then you can bring that arm through the full available range, your active and your passive are the same. I have a muscle weakness problem,
No.
I have a joint integrity problem.
Right.
So why couldn't this muscle be a 5? Give me some strength, give me some resistance.
I'm sorry, I gotta
Is
get
that
my-
possible?
Yeah. So then if you know it's a joint problem, you say, can they do range of motion against gravity in their range of
Available
motion?
range of motion.
Their range of motion.
Available range of motion,
available.
available range of motion. And when that case happens, you're gonna have the active and the passive be the same. The muscle is strong enough to pull that body part through whatever that joint is allowing it.
So it's
to
still a
move through.
5, but it's in pain. It could be causing them pain. It's a 5, but it hurts to do that.
No, but they
Because
actually can't go any further.
They put
Well,
her
my
in if it hurt.
guy at home, he's got something going on. We don't know if he tore a rotator cuff or if he's got tendinosis. He can't do it. He just can't lift his arm up, but he's still got muscle there.
Mhm.
It's still strong. It still feels like a 5,
Mhm.
but it hurts like hell.
Okay,
So, am I on the right track with it?
what is the difference between his active and his passive range?
His passive is not much at all. It's like a smidge past, and it just everything hurts. 'Cause
Okay.
he can get it to like right here, and then he's like right here, and it's killing.
Okay, you've got an impingement problem that comes from the scapula.
Okay.
Diagnosis done.
Bring
Bring 'em in.
So, and it's been going on for 2 years.
And it hurts here and on down to
It
here.
hurts, no, it's supraspinatus right here. It hurts right
Yes,
here,
that's
yeah.
what's being impinged.
Mm-hmm, yeah.
That's exactly what's being impinged. That's
Keep
why.
rubbing there, it's fine.
That's why you are externally rotating with your range, because if you don't come back to here, you are impinging your supraspinatus. But it probably is getting impinged because the scapula, if you come and dry this little pretty little scapula and put your hand all around that, you're probably gonna find that there's some sort of
There's a
asymmetry.
knot, there's a big knot back there, but I'm sorry, we're talking about him. So back to
Yeah,
her.
so
It's
if
hot.
it's a joint impingement, then the big thing I'm looking at is that the active and the passive are the same.
And then you're wondering, what is the muscle strength within that available range? So let's, we just looked at it, your active and your passive are the same, but you were able to take full resistance.
So it's
This,
5.
and you could be a 5. This time, let's say your active and your passive are the same, but you can't take in a resistance.
It's a joint problem and
Uh-huh.
So it's a
So the active and the passive are the same, so I would measure that with a goni, and then you're a 3. Now, if your passive was more than your active, now I would want to lay you in a gravity eliminated plane to see if you can actively pull that body part through the available range.
Okay.
Does that make sense?
Yeah.
Andrea, that's, yep, there we go. There's our answer.
Is that what you're wondering too?
Well, she was asking me a question, and I was like, I don't know. I was like, that was it.
But think
Oh,
about
yeah.
the
Yeah, that's
skeletal
what I was
system
like,
being
don't do
one
that.
thing and the muscle system being something else, and then just keep it straight in your brain. What are you looking at that moment in time?
Yeah.
Because when you talk about until this point in your life, you've probably said musculoskeletal system. And they're married, but they truly are 2 separate systems, and you're looking at the joint range, active and passive, and you're looking at the muscles, how well do they activate and pull that body part through the range against gravity or gravity eliminated.
So then, like with hers, it's like a nerve impingement, so that's not.
Not a nerve impingement, it's a muscle
muscle,
being
yeah.
Oh, muscle, sorry.
Hold on for Dr.
Okay.
Truskowski's class, not this coming summer, but the summer after that, you'll be doing that.
So for upcoming sims and stuff, is it fine for us to just kind of stay at the basic, doing our functional?
Yes.
And then our goni and then our manual muscle,
All-
and not get all fancy with the looking at 2 things at once kind of thing?
You don't have to be fancy. It's probably better that you stay in one lane
Yeah.
and then get in the other lane, because the more you have an understanding of that basic information,
Yeah.
what are you truly looking at, then you're gonna be ready to make it fancy with
Okay.
diagnosis and things.
This is kind of a weird question, but like, if we recorded you, could you show us what like a screen should look like in like motions that we should do? Like, if
Well, you could probably show us, come up here, let Josh.
I know what like the one that we've practiced, and I don't know. I just feel like there's some motions
Come
that
on over here,
aren't
let's
right.
see how it looks like.
Well,
This
like,
is
the
what
only
I
one
do.
that's different is like this should be different, or like I just want to make sure I have it down right.
No, does it have to be different?
No. Well, like from what
I feel like it's
oh,
more
because I know how to
beneficial.
do like what we like.
Alright, so let's lift your arms up. I'm seeing shoulder flexion, I'm seeing shoulder extension. Snow angels, bring your thumbs out and all the way up. And then I want to see external rotation. I want to see internal rotation. I want to see elbow flexion, elbow extension, supination, pronation, wrist extension, wrist flexion, radial and ulnar deviation, a big fist, and fingers all the way straight. And then if you're doing the claw, it is fingers in like this, more like you're carrying a suitcase.
Okay. Rather than like
Not like all make it claw.
Oh, I was like, rah.
yeah.
So
And then tabletop.
Okay.
Extrinsics, intrinsics,
Okay.
and then opposition.
Okay. So that's all good. Okay.
Yeah.
I just want to make sure I have
And then
it
when
right.
it comes to the muscle testing, maybe I truly do want to get your triceps in a gravity resistive plane to test that strength.
Okay.
But coming here, if you push against me, give me all, push me away. Is that a 5 or is that a 2 because I don't have you against gravity?
Is that a 5 or is that a 2? Because
You're 5.
5 for sure. Yeah, I'm a 5.
Because you give me full resistance.
Yeah. Okay.
Could your muscle be so weak that you can give me full resistance here, but then you would be unable
Okay, I
to do it
understand.
there?
Yeah. No.
No.
Unless they're fibbing, and they might be doing that.
Okay.
But you're gonna know
That's
the
good.
difference.
So like for the sake of the functional screen, we're pretty good.
I think so.
Okay, I just want to make sure because I feel like there was some like discrepancy.
Okay. Yeah. That's only because we're nervous. That was our first
Yeah.
time.
Well, like no, I was good. Like I had all that. I just knew we kind of like discussed like, okay, so should we do this differently in the functional screen? But
You did great.
even like knowing this is like this. Yeah, that's good to know. So
Yeah, there's a lot of things I missed.
like knowing that this is what the purpose is.
It takes some practice. So, do you want to take a break? Do you want to move on into bed mobility? You want to practice this a little bit more? What time is it?
3:30.